we know that the Ministry of Health and Social Services has always touted this as a very, very important event throughout the year, I mean, for the last 2 decades or so. Talk to us around the importance of this, and now that it's been sort of branded as the National Health Week.
Thank you so much. Yes, we see this event is very important. Why? Because we are going to expand the immunization program for us to immunize all kids under 5 years of age, so that we can prevent them for the illness such as diarrhea, pneumonia, and mention a few. This program, we want to ensure that all the kids, as you have said, in all the 36 districts need to be immunized, so that we can reach the, we hope we are reaching 90% as WHO wanted us to reach, because as I'm talking to you now, we are still at 80%. We want to move from 80 to 90, so that we can prevent our children from dying and our mother also from dying. As you know, MDG 4 and 5 is to ensure that mothers and children are healthy, and for us to reach our MDG target.
Well, Dr. Islam, if one looks at this, of course, we're saying that from a global perspective, worldwide, around 900,000 children die annually, 15% of which are under 5. That's because of pneumonia. But clearly, of course, I mean, the vaccine also plays its important role with regards to this. Can you perhaps share with us the international outlook on why this is still such a huge problem for international health systems?
As you said, globally, still a lot of children are dying because of pneumonia, and also that's the Deputy Minister said, of diarrhea. And we do have a vaccine, which is a pneumococcal vaccine, which can prevent children having a disease, right, and dying from pneumonia. So that's what we are trying to do globally, and particularly in Namibia. If you look at Namibia, child mortality has come down. And if we want to really further bringing down the child mortality, we need to look at other avenues, what we can do. So that's why the Ministry of Health and the government of Namibia has placed to make sure no child die because of diarrhea. They should not die, and also for pneumonia. And that's why we have, and the ministry has decided to introduce 2 vaccines, and which will be introduced now, which is pneumococcal vaccine, protecting children from dying from pneumonia and also dying from diarrhea.
Well, we know that, of course, we see that through vaccination programs, for example, polio was brought under control in the country. And you have been on record for saying that timing is very important when you're dealing with vaccines. Why is timing so important when it comes to vaccinations?
Yes, it is very important, because if you are not vaccinating on time, they will not get the really immunity which we want them to get. That is why we need always to target the under 5 for us to achieve the immunity in the society or in the community. You know, when the baby is born, we start giving them that vaccines. If you start by 9 months, you miss the opportunity of making those kids immune. That's why timing and right vaccines and right dose is very important if you give this immunization to the children.